of Americans living with depression and anxiety. Without education and the treatment, it could bring negative effect to their daily life and working. Today we invite Dr. Jason Jian to our studio, and he's the expert in psychologist. He will show us how to get the right diagnosis and how to treat themselves. Dr. Jason Jian, really happy to come to our studio. Could you introduce yourself to our audience, please?
Yes. My name is Dr. Jason Jian, and I'm a psychiatrist. Currently, I practice in two locations. One is in the Carswell Medical Center, which is offer the in-person treatment. Another is in Marietta. I offer the video virtual treatment. Most patients come to see me for depression, anxiety, attention deficit, or opioid dependence, which count for about 80-90%. Another 10% population, because of schizophrenia, bipolar, they usually need the injection or difficult treatment for that kind of about 10%.
Thank you for your introduction. Today, let's talk about depression and anxiety. First, could you define what are they?
People come to see psychiatrists, majority for depression, anxiety. Actually, most of the patients had those problems for years, even decades. For example, when they at a very young age, they feel they don't want to leave home to the school. It's because in the school they feel nerve-wracking, feel uncomfortable. Back then, we call it separation anxiety. But get older, especially they have to go to workplace, they also feel nerve-wracking, interact with others. So actually, many people suffer anxiety, nerve-wracking for years, decades. Similar to depression, many people don't understand why they just don't want to go out, interact with others, or don't have interest in to do things they usually prefer. But more than that, most people, not just because they feel down, feel sad, or feel nerve-wracking, it's because those symptoms cause their problems in their life, especially cause problems in their career. They couldn't go to do the work they want to, or interfere in their relationship with other family members in the workplace. They had a problem with co-workers, peers, or even get fired. Or at home, they had a problem with the spouse, with the kids. People with the untreated depression, anxiety, they usually have lost job is more than other patient. Or in the home, they divorce, have conflicts with the spouse, much more. That's actually the most people come to see psychiatrists for that reason, not just for feel down or feel nervous.
So do you think like the depression and the anxiety, do you see them as a personal choice or a disease, or is like the environment or the situation like cause it to like let me feeling down and like disturbing about my life?
Usually I ask my patients about whether depression, anxiety are personal choice or disease, or because of situation environment. They usually hesitate. They don't know which one is really right choice. Majority of people understand they are not choose the depression, anxiety, but they feel like they have some burden. They have some responsibility for the depression, anxiety. Also, many people thought an environment like situation, lost a job, or have fight with the spouse cause the depression or anxiety.
Yeah.
But right now, we have a solid biological evidence proven depression, anxiety are not personal choice. Environment situation just triggering factors. We have biological evidence proof depression, anxiety is diseases. These diseases similar like diabetes. Patients with diabetes, their pancreas cannot generate enough insulin. It's because that their body don't have enough capacity of process glucose. That's why their blood sugar go up. Not just because they eat too much. Many patients with diabetes, they probably ate too much initially, but once they found out that they have diabetes, they typically watch the diet carefully. But people with the depression, anxiety are surprisingly similar like diabetes. They are both chemical imbalance. In patients with the diabetes, the chemical is insulin. Depression, anxiety, the chemical happens to be serotonin, norepinephrine. So serotonin, norepinephrine are very, very important chemicals. I wouldn't say more important, but I definitely can say as important as insulin. When patients don't have enough serotonin, norepinephrine in their body, physically they cannot do what they're supposed to do. That's why they withdraw, isolate themselves. They don't have ability of going out to interact with others. That's why they feel depression. Mentally, they cannot do what they're supposed to do. Then they feel they cannot do things well, do things better. After that, they don't have confidence of holding the job, or they cannot find a better job once they lose it. Then consequently, they will concern about financial future, how to pay the rent, how to pay the mortgage. So they usually will not think about those concerns, those worries 24/7, but will be unconsciously stuck in the mind, meaning the wracking. And that's where the anxiety comes from.
So Dr. Jason Jian, could you tell us how does the antidepressant and the anti-anxiety works for our patients?
Yes, people with diabetes, no matter it's type 1 or type 2, eventually they need the insulin. It's because we know once the insulin level will improve, their body's capacity of processing glucose will be improved. Then glucose will go down, blood sugar will go down, everything will get better. Similarly, we help patients with the depression, anxiety, use a similar principle. We use medications to increase serotonin, increase norepinephrine. Then we can increase their capacity of doing what they're supposed to do. Physically, they can do what they're supposed to do. Then they will have the ability of going out to interact with others. Mentally, they have capacity of doing what they're supposed to do. Then they will have confidence of doing things well, doing things better. That confidence, that feelings is very important. Then consequently, they will not concern about too much. You cannot find a job, or you cannot hold the job, or financial future. That's how the anxiety will go away. Right now, we commonly use the medication, so we call SSRIs, like Prozac, Zoloft, Lexapro. Those medications can increase serotonin.
What does the antidepressant and anti-anxiety could do and could not do to our patients?
Right, that's afterwards. That's good. Like I just mentioned, we commonly use SSRI to increase serotonin, increase norepinephrine. Let me help you understand how the Zoloft and Prozac increase serotonin. Let me give you another analogy. There's engine in the car. There's engine oil leaking. You need a professional mechanic help you. Right now, I'm a mechanic. I help you how to fix the leaking. I put a paper towel under the car. 30 minutes later, I come back to see how many engine oils in the paper towel. Then I can decide whether it's mild or moderate or severe leaking. For severe leaking, possibly we have to replace the engine, but which is very costly. But fortunately, majority leaking is mild to moderate leaking. There are some cheaper ways. Stop leaking fluid is much cheaper. I just put it into the engine, then your leak stop leaking. You cannot drive before we put more engine oil in it. It's because if on that day I fix your engine oil leaking, but I forgot to put engine oil more, probably you will burn your engine on the way.
Yeah, that's
Then I will be responsible. But as soon as that day, there's no engine oil available because manufacturer cannot produce enough engine oil for everybody. Then what can you do? You have to come back later, waiting for we have engine oil available. So if you insist on that you won't drive home without adding more engine oil, then you burn your engine. That will be your fault. Or this is just engine oil worsen leaking, similar like how the Zoloft, Prozac helps you.
So when the medicine could not help our patient, is there other treatment that could benefit our patient?
One medication alone, some patients really feel the medications helped to a certain degree, but they always feel like not the place they want to be. They think maybe we can increase medication dose or change to other categories. But in most situations, it's because medication is limited. Last time we talked about engine oil leaking. So serotonin, similar like engine oil. Engine oil has to be in the engine. If the leaking away will not be working. Serotonin also have to be somewhere in the brain. If they reuptake away, will not be working. So you can see the parallel between Zoloft, Prozac versus stop leaking fluids. Prozac, Zoloft actually just stop leaking of serotonin. That's it. The chances are, like engine oil, you stop engine oil leaking, you have to add more engine oil in it. If you don't, that will not be working. Similarly, our brain. If you just stop leaking of serotonin, the chances are patients with the depression, anxiety, their capacity of producing serotonin has been decreased. And right now, Zoloft, Prozac cannot increase production of serotonin. And we don't have medications to do that. But that doesn't mean that there's no ways we can do. Actually, we have two ways to increase production of serotonin. One is fasting. Fasting usually be difficult. You have to stop eating at least 24 hours. That's tough for most people.
Yeah.
But majority of my patients prefer exercise. Exercise actually is basically way of increase production of serotonin, increase norepinephrine. So in this way, you can say, if you just stop leaking, that's not enough. So this is why so many medications, antidepressants, working so slow. You only take 3, 4, 5 weeks. It's because they still painfully waiting for brain to increase production. If they don't, there's not much we can do. And that's why we encourage patients, besides taking medications, also do more exercise. That's how they can combination both can do better. But right now, there's big misconception. So many people confuse with physical activities with exercise. Walking around, chase dog, or play kids with you, that's not called exercise. When we talk about exercise, we talk about intensive physical activities. So the key words is intensive, meaning you have to meet certain criteria. Typically, you need to make your heart pounding like 140 beats, 150 beats per minute at your age, at least 30 minutes, at least 5 times a week. In that way, you can increase your production of serotonin. You just walking around, then you will not be working. So that's why, besides you take medications, exercise is important component in the treatment of depression. So in the future, I will help you understand more about why we need intensive physical activities.
Thanks for Dr. Jason Jian answering all our questions today. And if you have any question about the psychiatrist, please contact him. And don't forget to subscribe our channel so you won't miss the following videos. Thanks for you again.
Okay, thank you everybody, and especially thank you for listening and watch us today. If you have any concern, questions about depression, anxiety, attention deficit, opioid dependence, please contact me.